This sketch is on immunomodulatory therapy. This is the type of therapy we use for uveitis, anterior, posterior, intermediate, panuveitis, when traditional steroid measures have failed. This is coming from the BCSC book 9, Uveitis and Ocular Inflammation, specifically pages 106 to about 113. We're going to talk about 3 classes of non-biologic agents, including the antimetabolites, the T-cell inhibitors, and the alkylating agents. We're also going to talk about the biologics, which are the monoclonal antibodies. For this memory sketch, we have a robot uprising. The robots are going to represent the antimetabolites in the metal factory. The Terminator is going to represent the T-cell inhibitors. The atomic bomb in the background is going to represent the alkylating agents. And the woman fighting back as the only living creature in this picture is going to represent the biologics. Our 3 anti-metabolite robots in the metabolite factory are azathioprine to the left, methotrexate in the middle, and mycophenolate mofetil to the right. First off, azathioprine, which is demonstrated by the AZA branding on the robot's chest, is holding up a piece of machinery that looks in structure similar to a purine. This is to remind you that azathioprine disrupts purine synthesis. There's a greasy green oil stain on the robot's body in the size, shape, and location of the liver to remind you that azathioprine is associated with hepatotoxicity. And finally, the robot is grabbing a bone in its right arm, and the bone is cracked. This is to remind you of the bone marrow suppression of azathioprine. Moving on to methotrexate. This is a little child robot because methotrexate is first-line therapy in children. He has a little MTX on his chest to remind you of the name. And if you remember the methotrexate sketch from Sketchy Farm, he has the little sushi chef headband on. Methotrexate is a folic acid analog and inhibitor of dihydrofolate reductase. When you prescribe this medication, you must also supplement the patient with folate. To remind you of folic acid, inhibitor of dihydrofolate, and supplementation with folate, I have this little robot kid holding a roll of aluminum foil. Methotrexate is also a teratogen, so we have the teratogen tarantula. And finally, methotrexate, like azathioprine, is known for hepatotoxicity, so we have the same liver-shaped oil stain. And finally, mycophenolate mofetil is there on the right. It is an adenosine monophosphate dehydrogenase inhibitor. For the life of me, I couldn't figure out a sketchy symbol for that, but I have the letters MM on its chest to remind you of its name, and I also have it clutching its stomach and looking a little queasy because it has a known side effect of GI upset. Okay, we're done with the antimetabolite metal factory. We're going to move on to the T-cell inhibitor Terminator. This class of medication is made up of tacrolimus and cyclosporin. Tacrolimus T, cyclosporin C, and they are T-cell inhibitors. So I've written on our Terminator TC on his chest. Tacrolimus and cyclosporin are known for their nephrotoxicity. Tacrolimus a little bit less than cyclosporin. So I've included a kind of kidney-shaped backpack, storage pack on this Terminator that's dripping some toxic-looking oil to remind you of this nephrotoxicity. This came off a little bit more subtle than I wanted, but if you can see the Terminator's mouth, he has some pinkish gums showing. This is to remind you of cyclosporin's notable gingival hyperplasia side effects. Moving on to the last of the non-biologics, the alkylating agents, the atomic bomb, or should I say the C-bomb, to remind you of the name of both of these agents, cyclophosphamide and chlorambucil. These are extremely potent agents with a lot of toxicity, and so I made it the devastating effect of an atomic bomb. Alkylating agents are extremely damaging to DNA RNA, so they are quite obviously teratogens and also have some myelosuppression. So this applies to both drugs in this class. Both drugs also have an increased risk of malignancy. Be very careful with these drugs, and they have a risk for death. So I wanted to make a lot of red in that sketch to kind of give you red alert, caution, there's an increased risk of malignancy. Specifically for cyclophosphamide, there's 2 high-yield pieces of information you should know about it. There is a side effect called hemorrhagic cystitis, and to remember this, I've made this mushroom cloud, yellow on the top and full, kind of like a bladder, leading down into bloody dust trails at the bottom to try and remind you of a bladder that's having hemorrhagic cystitis. Its other notable side effect is the increased risk of PCP pneumonia. So you should put your patients on PCP prophylaxis, which is trimethoprim sulfa, as represented by these smelly sulfur eggs. And finally, we have the biologics, which come from humans. So we have the only human here in this sketch. She kind of looks like Sarah Connor. These are the TNF alpha inhibitors, adalimumab and infliximab. To remind you of this TNF alpha, I have our human warrior here has some TNT on her hip. Like the alkylating agents, the biologics also have an increased risk of malignancy. So I've made these TNT sticks bright red to remind you of that red alert malignancy. And finally, the biologics are well known for central nervous system demyelination, either promoting or unmasking multiple sclerosis. So I've created these little gray zigzaggy streaks on her hair to remind you of the demyelinating lesions on MRI. Alrighty, that was immunomodulatory therapy. Thanks for listening.